So I am going to be talking about domestic violence today. So let me share my screen. Can you all see the screen?
Yes.
Yes. Okay, I'm going to stop sharing because I'm sharing the wrong one. It's not showing me the right one. Oh, it still is. Let's try again. Third time's a charm. We'll try this time and it doesn't work. It doesn't work. Okay, you all can see the screen.
Yeah, you can just make it in presenter mode if you don't mind. But now
Yeah.
I'm seeing your email, so go ahead and go back to your PowerPoint view.
Well, okay. So I will put it in presenter mode. Okay. There we go. Okay, perfect. Sorry. So today we're going to be talking about domestic violence. When we talk about domestic violence, you can hear it overlapped with intimate partner violence. So a lot of people talk about domestic violence and intimate partner violence, and it can be categorized emotionally, sexually, physically, and threats of abuse. But there are other areas that we talk about with domestic violence too, and we'll be covering some of that today. We just missed our National Domestic Violence Awareness Month. So last month was our National Domestic Violence Awareness Month. So next year, when you see the purple ribbons, you'll know what that's for if you're not aware of what that's for. But domestic violence or intimate partner violence refers to abusive behaviors in any personal relationships that allows one partner to intimidate or gain control over the other. And many of the times when we think of domestic violence and when we talk with people, and even when I talk with victims of domestic violence, they'll say, but they're not my intimate partner. Like it might have been their father or their brother and the reality is that it's any relationship within that family system or in the same home. And so domestic violence impacts the entire family, and it can be any real relationship inside that family system. And so we think of it outside of that scope of just that intimate partner relationship. A lot of the times you'll see that like we said, it impacts the entire family system, and while it can stay within some of that intimate relationship, we see sometimes it go outside and also impact child abuse as well. And so 30 to 60% of intimate partner violent cases also include child abuse. So we do see it go outside of that. And then I think the more shocking statistic is that 275 million children are exposed to domestic violence worldwide. And so a lot of the times, and we know that that impacts kids. That's one of our, when working with young children, that's one of our number one pieces that we ask about is if if they've witnessed domestic violence. And many of the times people are like, yeah, but they were like only one, or they were only a baby, they were too young. And they're not too young, right? We know that violence completely restructures and rewires the brain. And so they do have an impact, maybe not a cognitive memory of that, but that's some of that early adverse childhood experiences where your body kind of takes the toll and your body remembers and reacts and responds. And so it definitely does impact children, even early on, even in utero. We're going to go through the signs of domestic violence and interpartner violence for verbal abuse, the physical abuse, emotional abuse, sexual abuse, and also financial abuse. So that is a piece that not many people hit on, but I think that's a big piece, especially with the victims that I work with. It's a huge piece, and we see some consistency amongst that. So with verbal abuse, some of the signs for individuals to think about, and it's so interesting because, when I come across victims, I have victims that are like, yep, I'm in an abusive relationship, and they're ready to talk about it and they're ready to deal with it, right? I have other ones that are like, oh, I don't really know if this is an abusive relationship, right? And so it really comes down to those. And if you think about those stages of change, right, where they're at and ready to change is kind of where I get some of the education and knowledge of their own abuse and reflecting on their own abuse. And so when they're ready for change, then they're ready to talk about that. But when they're struggling with wanting to change, they're like, I think it might be a problem, but I'm really not sure, right? That's when they don't have a whole lot of information on if it really is, or a lot of the times, and we'll talk about this, blame becomes a significant piece too, that self-blame that kind of puts them and perpetuates that cycle. So verbal abuse is, and we see this a lot of the times is, some partners make fun of one another and are playful about that in public, but this is when we see consistent humiliation in front of others, like talking about their partner or making fun of them in front of others constantly. And this is that chipping away. Like throughout this, you'll see a little bit of chipping away. And that's where you see some of those signs of abuse. Like I always get a little bit of a red flag with that, but some of it can be harmless. But this is where we start to see pieces that are chipping away, and this is where you want to see themes and consistency in this. Constantly putting down looks, interests, and other things, like telling them, that doesn't really look so good, right? It doesn't start off harsh. It doesn't start off with "you're so ugly," it starts off with "you don't really look so great in that," or "that's not really you," or right. So a lot of the times it starts off easy and then continues to chip away. Or even interest, like, is that really you? Like, you don't really look like you're having fun doing that. Is that really something you're interested in? And really causes people to question their own choices, their own decisions, and whatever they're involved in. And then it can naturally escalate to yelling and screaming, threatening to hurt them and others that they're with, or children, right? Like, the verbal abuse of, if you don't do this, then I'm gonna take it out on the child, or and threatening to keep things from them. You're not going to use the car if you do that, or you're not going to be able to go shopping if you do that. And so really, and we're not talking about like clothes shopping, we're talking about like grocery shopping, or major needs. And then, of course, physical abuse. We see with physical abuse, hitting, kicking, slapping. But a lot of the times it'll start with, and victims will talk about like blocking or barricading, right? Just not being able to escape or go out somewhere, or maybe just a shove, like just a, and not to downplay it, but just like a little shove, right? Like a little push back, right? Enough to like stop somebody in their tracks, but not be like, oh, well, that was abusive. But it is. These are those little pieces that start to chip away, and you start to see them coming over and over again, throwing things at them. Like I've had victims that talk about at the beginning, like it was throwing like pillows and harmless items, right? But it escalates because it's about taking that power and control. It's not really about the harm. It's about taking that power and control. And if they're imbalancing it, and so if they throw that balance off and they're starting to make this person not feel good, not feel, or feel threatened, or not know what is coming next, right? They're meeting some of those needs of throwing that power and imbalance off. And then emotional abuse. Abuse, I feel like is the most prevalent that I see. I see more emotional abuse than anything. Guilt tripping into doing things for, or feeling bad. Gaslighting, so making the other person feel like they're in the wrong, or that what they're thinking is not accurate, or that they had created this situation, right? So kind of gaslighting that situation. The silent treatment is huge, not talking for specific behaviors. And then we see those behaviors being used. Controlling who they're with, when they're with people, right? Making them feel bad about choosing to be with people, even their relatives and loved ones. So starting to isolate them from any type of supports or family, friends, or friends, right? So the more that they can isolate, the more they can throw that power imbalance off and have some of that control. And if you think about it, when you have support and you're feeling frustrated about a situation, you go and talk to somebody. Why do you go and talk to somebody? You go and talk to somebody so that you can kind of get those thoughts out and talk about it and process it and make sense of it, right? And if you're making sense of this because you're feeling like a little imbalance, then it reduces that power that other person has. And so they like to isolate so that you don't have that ability to gain support from other individuals. They start rumors to kind of reduce that support that you have from others, blaming you for everything and spying on devices. I mean, I know people, I know in relationships, a lot of people check phones and look at that. But in abusive relationships, they're checking phones, they're tracking, they're identifying where you're at all the time, questioning it. It turns into arguments, right? That's when it's becoming abusive. Even cameras inside, like I've had victims talk about how they have indoor cameras, and their abuser would just kind of watch them and identify what they're doing and tell them what they're doing, right? And that is that power and control, right? If you know that somebody is watching you all the time, what's going to happen? It's going to change your actions and your patterns of interactions. So that is that power of control. You're throwing that off, right? And then financial abuse. So financial abuse is, I always think this is an interesting one to talk about, because we don't talk about this much, but I feel like almost in every abusive situation that I've dealt with patients, I see this financial abuse that comes about, like from abusers telling the victim to leave work, or preventing them from getting a job, making them late and not giving them rides, hiding the car keys, calling work, causing a scene at work so that they don't have a job, or taking control of the finances, right? So even though they work, the abuser has control of the finances and what comes in and what they get and how much they get. Selling things at home that they didn't even know were being sold to get money, refusing to pay them or pay their child support. We have a couple right now where they're refusing to pay the child support, and it's a huge burden for somebody that just left and went on their own. But that's how they can still have some of that power and control. And so we work on managing their finances as best they can, and kind of ignoring that for now, because we don't want to feed into we don't want to give them that power and control. If they respond to them, they're giving them some of that power and control and acknowledgement. So it's a hard balance, right? Because you have that extra stress of finances, which is huge for everyone. And then you're trying not to feed into this power and control cycle, which can be really, really stressful. And then having kids on top of that is super stressful. So imagine the stress of a victim just leaving. So that's the finances. And then if you look at sexual abuse, and a lot of the times we see this, and after processing, I think for not straight sexual abuse cases, but for victims who have been in abusive situations over long periods of time, I feel like these sexual abuse pieces surface over time, and they don't even realize that they were sexual abuse pieces, right? Might be having sex at times where they didn't really want it, or sex getting a little rougher than they had wanted or anticipated, but they kind of went with it, right? Or just kissing and touching when they didn't want it. And so starting to realize like that was abuse, right? Even taking pictures and not really wanting to, pressuring into nude photos and having those, and control over birth control, right? That one I think can be really prevalent too, in telling individuals that they're not taking birth control, they can't, or removing condoms or birth control methods without telling the other person, so that they do become pregnant, right? And those are really difficult situations. And then that becomes unhealthy, not only for that relationship, but now this unborn child's relationship. And so that can be really stressful and difficult as well.
There is a question in the chat, Amanda. So the question is, would behaviors like punching walls or smashing furniture fit with domestic violence, interpersonal violence?
Yes. So that is categorized as domestic violence, right? Because just like throwing things, right? So we would put that under throwing things with physical abuse, because you're having a violent action. It might not be towards that individual, but the intent, right? You have to look at the intent. The intent is because they could be losing control and taking control in another way that is threatening or scaring another individual, right? So that's violence and abuse. And then if they use those tactics to control that individual, that is definitely violence and abuse. Great question. Yeah, good question. So just, just a visual for that, I'm a visual learner, so I like to throw out those visuals, the abuse and the victim, and then that situation in the middle. So looking at the situation, the intent and the need to take power and control over that other individual. And sometimes with domestic violence and abuse, sometimes it's not intentional. Even working with abusers, I mean, I've worked with the abusers as well. And that actually helps me in domestic violence and sexual abuse. I've worked with victims and abusers, and I remember with sex offenders, people asking me like how I can work with abusers too. And it really is helpful for me because it's easy to create this villain in the abuser when you're hearing all of these awful things, right? But when you work with both, it balances you out to kind of identify where that's coming from and why that's happening. And so when you think of the abuser taking this power and control, sometimes when I've worked with abusers, they've not even identified this as a pattern until later, right? Once they kind of got their needs met by doing this and identified the cycle themselves and where they're at with it, they realized like, oh my gosh, I've created this pattern of interaction, right? They're not always fully aware that this is what's happening and this is what's going on. And so it's really helpful to engage in treatment and to begin to identify those patterns of interaction so that you can reduce it. Like and what made me think of that was that question, right? Like if you start punching the wall out of anger, but you get a response, chances are you're going to do that again, right? And maybe not cognitively, but maybe it just becomes this pattern of interaction to get those needs met. And especially if you've had, not to go really deep, but especially if you've had some of those early adverse childhood experiences and you're dysregulated in a way where you can't control those emotions and you find a way that you can, you're going to go back to that over and over again, even if it's unhealthy. So when we want to make sure we address, especially with domestic violence and interpartner violence, there are some barriers when it comes to same-sex, transgender, bisexual relationships. A lot of the times this is a difficult population to share these things with. Because it threatens exposure. It threatens exposing their family, their friends, their sexuality, right? Their gender identity. And so it could be a couple folds, and it can be really difficult, especially with the history that we've had with domestic violence with same sex. And identifying as a male, right? Sometimes then you have a difficult time with authority and believing that I think we've gotten better over time, but there's definitely still some stigma around that. But this can be a really scary and difficult process. And so just identifying some of those signs. And then in pregnancy can actually increase domestic violence. A lot of the times, especially if it's an unplanned pregnancy, planned pregnancy, we've talked about sexual abuse and how sometimes that can lead to a pregnancy. So there can be a lot of stressors around pregnancy by itself, and then adding some dysregulated emotions and some patterns of violence and violent interactions. This can definitely increase domestic violence. It can place the unborn baby at risk. And a lot of those interactions, by the third trimester, babies can hear two voices outside of their mothers. And so a lot of the times, if those are violent interactions, it can increase the mother's cortisol level, and then the baby can kind of correlate those cortisol levels with that loud noise, and it can have negative implications on them in utero and then postnatally. So it can like kind of overstimulate them, right? It ignites that fear factor. And a lot of the times it's really hard to reduce that. So we can see some overstimulated babies. So when we're looking for signs of domestic violence and interpartner violence, you want to look for bruising, sprains, like unexplainable accidents. And we're not talking about every now and then, we're talking about consistent patterns. A lot of the times it's the same bruising and same sprains. So if you see like somebody that breaks their wrist, like, you know, over and over again, the same wrist, right? Those chances are that that wrist is being grabbed, or the same shoulder, or, you know, so when you're seeing some of those same bruises over and over again, a lot of the times I like to just kind of do a you know, like a medical approach, like I mean, what's going on that you're getting the same bruise? Like, have you talked to the doctor? Do you want to explore that? Can I help you with that? And sometimes that can be a little more non-threatening. It's just going the medical route. Low self-esteem. So individuals having low self-esteem, or if they've had, you know, I see it with especially some of my victims who have had amazing self-esteem, and then it drastically reduces, right? Like, what's going on, especially when it's a change. But low self-esteem over time with domestic violence, and many of the times domestic violence is repeating a pattern. So many of the times you'll see victims that have grown up in domestically violent homes choose some of the same partners because they're used to those patterns of interactions and those relationships, and they become normal. And like we said, the body kind of takes the toll, so they kind of look for that unconsciously. So sometimes that low self-esteem is already there. Overly apologetic. So individuals who apologize all the time. I mean, we all know some individuals that apologize all the time, but we're talking about like overly apologetic for everything. So that's a sign. Being fearful, right? Fearful of sudden movement or easily startled. We can see that sometimes. A substance use disorder, suicidal ideations. We'll see an increase of suicidal ideation sometimes with domestic violence or interpartner violence. Being withdrawn in social situations. So almost fearful to relate or to build those relationships, right? Because part of those patterns are to isolate that individual. So we see them withdrawn a little. Canceling plans, appointments, social gatherings. So a lot of the times they'll gather or cancel those. Being late often, again, not having control of situations and kind of being late. Very private and isolating themselves. So, and we talk a lot about that cycle, right? And you'll see a lot of different cycles and kind of building, but these are the three major pieces of that cycle. And we'll start in the honeymoon phase, because most relationships don't start with tension building or major explosions. I don't know many people that get together when you see somebody explode. So we'll start in the honeymoon phase, and that's kind of good. It looks good, right? They're treating you good, they're acting good, and then you can maybe pick up some tension, maybe moodiness, just some nitpicking, you know, kind of those little pieces that I said, like, start to kind of put you down subtly and just start to chip away. So you see some of that attention building, and then an explosion, right? Like maybe punching the wall or throwing something or screaming, right? And then comes the honeymoon phase again. So then they're like, oh, I lost control, right? Like, this isn't going to happen ever again. I'm so sorry. Maybe some flowers, and right, that's such a stereotypical, the flowers. And then moving back into that tension building. So that we see this cycle just kind of happen and happen. And a lot of denial with that. And it does, like we said, it does become a pattern of interaction. And sometimes the abuser is stuck in this cycle as well. And so, you know, sometimes once you identify how, like, what's going on with them, getting them out of that cycle as well. And it's hard for the victim too. And we'll talk about reasons why people usually stay, but a lot of the times it's self-blame. A lot of the victims that we work with, especially ones that have that low self-esteem, right, come from a lot of families. I work with a lot of victims that are involved with substance use disorder, so they feel defeated or that they deserve this, right, for some of the actions maybe that they have taken. So they blame themselves, and because the abusers blamed them, right? maybe they stood up for themselves and acted out against the abuser, and so now the abuser uses that, right? Like you do that yourself. Sometimes when they speak out and nobody can relate or identify with them, or doesn't know what to say, so they don't talk about anything, they change the subject, right? They feel alone, and so they can shift outside of that.
Amanda, I had a question come in.
Yeah.
And says, don't you ever find the abuse victim sometimes to be overly aggressive with others as her abuser is when she is protecting the abuser?
You know, that's a great question. I think that I don't see that a whole lot. I feel like when I see that, I see them being overly aggressive. Like when I see individuals being overly aggressive with others, a lot of the times I feel like it's their anxiety of other people finding out what's going on with them, or being put in a situation where they would have to share some of that, right? So sometimes I see more of that, but I definitely can understand what you're talking about, is seeing some of the over aggression, but I feel like it comes from something deeper, and a lot of the generational pieces that I'm talking about. So individuals who've been in generational abuse and patterns of interaction like that, I feel like aggression is just like a second nature. Like I have a patient now that I work with where she gets so aggressive so fast and she doesn't even realize it, right? But she's been involved in domestic violence since she was 3. So it's her natural response and pattern of interaction, and so she doesn't even realize it. And so I guess you're right, because like I'm saying with the anxiety, like I guess it's a response and a pattern of interaction. So yeah. Why do victims stay? Love. I have the ones that are like, I just love them, right? And so and supporting that, right? I so badly want to be like, oh, this is not love, but I would never ever say that, right? Because that would be totally inappropriate. But they do love, and that's their perspective, right? This is their love. Fear from a lot of different pieces. Fear from exposure, fear from leaving, fear from, not being complacent and comfortable within that relationship and that individual, fear of what's going to happen with their children, what's going to happen with their family system that they know of. So a lot of different fear of financial reasons, right? Fear of them following them, chasing them. I've had victims that have left for years. I have one now that's been gone for 2.5 years, and her abuser just keeps popping up, right? And it's to the point where she's like, why do I even try? Like, I might as well just get back with him so that I don't have to live with this fear, right? That he's just going to keep popping up. And she doesn't. She's working hard at that, but like time and time again, it just happens, right? And how many times do we see and a lot of the times you'll see victims go back over and over and over again. And while it's very frustrating, we'll talk about ways to kind of support that. It's very frustrating, but we have to understand why they might be going back, and sometimes it's easier for them to do that, maybe in the short term but not long term. So working with that and understanding that a lot of relationships believe in for better or worse, right? Like I've committed and I'm in this for better or for worse. Or it can go to that kind of church belief, right? That religious belief of I committed to this individual, and I would be shamed at church, and it's I'm supposed to be with them. That self-blame. We talked about children, right? If children are involved, how am I going to take care of my children, financially, emotionally? How are my children going to feel about that individual? They're going to still have to see them. I'm going to still have this interaction, right? So a lot of questions around that. Pressure from family to stay together and work together, right? We work on things. Like I've had victims where it's like my family says, we work things out. We don't just leave relationships, or, this was my choice, so I have to figure this out, and kind of isolating, right? And lack of support, like we talked about, financial reasons. So what can we do? So listen to them, listen to their stories. Again, this is theirs, no one else's but theirs, right? Understanding their point of views, learn some of their signs, what their signs are, and when they may be in trouble, and the signs that you're seeing with them, and when that increases, and even have those discussions like, how can I help you in these situations? What can I do for you at this point, right? Like, I know in group, we've talked about, in Laura and I's group, we've had a couple, and we've talked about even code words, right? Because sometimes partners would be right there and not let them talk and not let them, and we wouldn't want to put them in a situation where we would do that. So we would have code words that they can talk freely, or if they were in danger, right? We're going to talk about produce for the day. And I remember I used that one time, and the one patient was like, okay, she's like, I really want to talk about produce for real, guys. Like, I really want to talk about the farmer's market. So we're like, okay. But using some of those code words so that we know their signs and we know that we're making that a safe environment for them. Believe them when they tell you what's happening, right? Sometimes some stories and some situations can be so outlandish, but believing them and understanding that this is their story, this is their perspective, this is their point of view. I am not an investigator, so I'm not investigating if this is the truth, but believing them and supporting them so that the truth does surface, right? Even if it's not the truth, it will surface from building those relationships. And sometimes people do it for a shock factor, right? Like, I've had some patients that have had such complex and severe trauma over their time and have some thought disorders along with it, throw out some complete outlandish story. And when I don't respond when I don't respond from like giving like clear nonverbals, like, oh my gosh, they'll be like, okay, so I'm going to tell you what really happened because I think you can take it. Right. And I'm like, okay. Like, so I think sometimes they're also trying to see, if we're ready, if we're able to handle it. The one patient I shared with you all about the history of violence since she was 3, she's been through so many therapists, and she told me at one point, she's like, I didn't share everything with you because I just wasn't sure if you were able to handle it, right? Like the consideration of like, sometimes some people just can't handle all of the violence that has occurred. And so I think just believing them and validating those emotions are really, really important. Forming a safety plan and finding a way to form a safety plan, right? So this is just a small example of a safety plan, but it could be as simple as like what we've talked about, like having a code word, and then, we talked about following up with mental hygiene if needed, and what that looks like. When we were having groups in person, I remember us telling one group member, like, when you come with a bigger, because she had some big purses, so a bigger purse and it's full, we know we're not letting you out of this room, right? Like, we're escorting you where you need to go after that. And she was good with that. But safety plans of gathering evidence. So when we talk about evidence, helping individuals gather like police reports, pictures, things that they feel like they might need, packing a bag and hiding it. A long time ago, when it's probably been like 15 years ago, I had a victim that kept a bag in my office. She brought a bag once and she just had it there in my office. And so we kept it there because she was scared of if it was found, what would happen. And that's a possibility, but sometimes keeping a bag, hiding it, thinking of where they can go. What are their options? Sometimes, we have to help facilitate some of that with a shelter or resources, but finding where they can go, exploring those best and worst case scenarios, right? So that they know what to expect and we know what to expect and what we can help with. So making sure that we are exploring those best and worst case scenarios, planning for the next day, right? That first move is so much adrenaline, so much going on, that sometimes then we forget, okay, now what? Now where do we go the next day, right? And so planning for the next day, what does that look like? What kind of resources do you need to start being linked to? And sometimes it's too much for some people, right? Sometimes when I talk about planning for the next day, they're like, listen, I just need to get out first, and then we'll think about that. And I'm like, okay, so then let's set up that appointment for afterwards and what that looks like. And reviewing their emotions, making sure we're exploring those emotions and reviewing that with them. And planning for that honeymoon phase, right? Planning for that phase and what that's going to look like and how that abuser is going to come back into your life and those boundaries you need to set at that moment in time. And for us as sometimes as providers, expecting that they could go back, right? They could go back, and how are we going to support them? And what is that going to look like? So even us kind of reviewing our own emotions, it's a parallel process, and not to get frustrated with that, but make sure that we're emotionally ready to be supportive of them again. What not to do, right? So thinking of what we definitely don't want to do. We don't want to bash the abuser and tell them to leave them, right? And again, this is sometimes when working with abusers is helpful for me, because sometimes listening to stories, I automatically want to bash the abuser in my head. But we don't want to do that, especially, and if we think about it and not share it, like at some point, those emotions are going to come out for us. So even processing how we're thinking about that, we don't want to side completely with the victim, right? Because again, some of the story, this is their truth. This is their point of view. And while we want to believe them, it's not our job to side with them. We don't want to underestimate the potential danger, right? Even if this has happened over and over again, or it's never escalated to this point that they might get to, we never want to underestimate the potential for danger. And we want to talk about that. What's the worst case scenario? What would that look like? How would we handle that? Give conditional support, whatever we can at that moment in time. But we don't want to only give support while they're leaving, or if they're talking about leaving, right? We want to give support the entire time. And even if they go back, we still want to be able to provide that support. We don't want to pressure them to leave, right? That might not be the right situation for them at that point in time. We don't want to tell them that they have to leave or that they need to leave, right? That might not be, or, and many of the times, and, I've had some that have lost their kids because it's been a difficult situation. It's been a violent situation in the home. And so a lot of the times there's judgment on, well, they've lost their kids because they can't choose their kids over the abuser. But I mean, we just saw that cycle. There's a lot of reasons why individuals don't leave, and many of the times it takes a while. I've had individuals come back for their kids, right, and work towards that, but it's a hard process at times. I've had to work with individuals and support them and wait for them for months before they realize, like, listen, I gotta support my kids here, right? We don't want to give up. So again, we don't want to give up. We don't want to make things more difficult, right? So sometimes giving our patients ultimatums, or kind of downplaying some of the situations can make it more difficult for them, right? If we downplay what they're experiencing, and if they're showing us this potential for violence and we're downplaying that, they're going to question themselves, right? And we're talking about individuals who already have low self-esteem and issues with self-blame. And so we definitely don't want to do that. This is their story. This is their perspective. So we're supporting them. So, and there's a hotline. So there's a national hotline, and moving forward, providing this, I have little cards with this. I have a magnet with this on it. We talk about this from the beginning. So just having that safe space to do that. Any questions? Any other questions?
Thank you so much, Amanda. That was wonderful. And just looking at the different ideas of what domestic abuse could look like, I think is really important, because I think many people think it's, hitting only, but there's just so many different avenues. So appreciate that. I see you unmuted, Maggie.
Yeah, I unmuted. I was just going to say, I was glad Amanda touched on that with CPS, and sometimes they end up losing their children because when she said we don't want to, sometimes they go back and we want to stay supportive. and it's hard sometimes for CPS worker, like we can't stay supportive of that when they go back, and we have to say, you know, we can't go along with that because you can't take those children back into that atmosphere, into that situation, you know. And I've been in that situation where I said, you can go back, but those children cannot, you know.
Yeah.
When I had to make that statement, I was standing beside a police cruiser with the kids in the police cruiser, you know, and she was kind of like, can I go with you? And she just jumped right in the police cruiser too, you know. So I was fortunate, but yeah, we can't be so supportive as a CPS worker of going back.
Well, I mean, but I think that is being supportive, right? I mean, you have to, we all come from different lenses. And like we're talking about, you know, that's their perspective. This is their perspective on that. And sometimes once they process it and get more support, they can identify their perspective is a little off at times, right? Your perspective is coming from a safety perspective and keeping the children safe. And at some point, I will say, working with parents, they get that. And they might not right away. And I think, you know, and talking about, if you look at some of the don'ts, right, like don't give that conditional support. Like I think that CPS is very consistent when they're involved, right? Like they have to take those kids and they have to stay involved and they have to, right? And that's a consistent piece. And you can remain supportive at that time. You can remain supportive of this individual and understanding that it's hard to get out of that cycle and being there and being consistent. Like, I mean, I don't know the situation where that mother jumped in the police cruiser, but maybe this was the second or third time, right? And she knows, like, this is a safe place. I have to get there, right? It might not be, but being supportive and ongoingly being supportive, I think can be beneficial. And so you can come alongside, right?
Mm-hmm. Yeah. Well, yeah. That situation wasn't the second, third time. It was just horrible. But and I was lucky, you know. But you know, I in all my years, I only had two situations like that where it happened like that, and they never went back. You know, it was so horrible, and I think she was just glad we showed up. But yeah, it's. I was glad you went on and said sometimes they choose and I understand it's a mad vicious cycle like you did with the flowers and the I'll never do it again. It is a mad vicious cycle. I get that. But I was glad you brought that in, that sometimes it just gets to the point where they end up because they can't choose their children over the man. And that is love to them because that's the only example of love they've ever had in their life. So
right, if it's that generational pattern of interaction, you're right, that's all they know, right? And they don't sometimes they don't even understand why it's wrong or what exactly is wrong about it until you start kind of processing through and being available like that. And so it's hard but it can become to the point where it's violent for the children and it's not a safe situation. And that's where your perspective comes in, right? And so understanding perspectives is a big piece we take in working with domestic violence, even the abuser's perspective, right? We've talked about, I had one mom where she was like, you know, I can understand where he's coming from. And talking about it, I totally could see his perspective and where he's coming from, right? Like but it's still violent and you still have to address that part.
Thank you so much. Any other questions before you go into the case portion? All right. Thank you so much again, Amanda. And if you have any questions, please send them our way. We'll get them to Amanda after the fact. Deborah, are you ready to present your case?
Sure.
Excellent. I can share my screen. I have it with me.
Wonderful. Thank you. Because I am not tech. So that is awesome. So my name's Deb Grant. I'm an advocate with Disability Rights of West Virginia. For folks who aren't familiar with disability rights, we're the federally mandated protection and advocacy organization for the state. And so starting in the 1970s, U.S. Congress passed different pieces of legislation to ensure the rights of people with disabilities are upheld in every state. Every state has one. We're it for West Virginia. And I do a lot of different things. And one of the things that I get to do in this job is I get to do a lot of work with children and families based on my background. And so this is a case that I kind of pulled from one of my 5,000 previous jobs, and thought that we could talk about it today. And so I'm not really sure what I want to do here. Do I just kind of go through it? Okay. So the situation is we have a mom in her 30s, a male child about 4, an infant child. The referral was based on mom drinking and driving. And so there were lots of strengths in this case. And so I wanted to highlight those like from the get-go, because I feel like that's really important. So one of my other 5,000 previous jobs was I used to be a special ed teacher. And one of the things I learned in my methods class was use strengths to remediate weaknesses. And so this family had a lot of strengths that would have been really useful as this case would have progressed. And so I can tell you, I am the socially necessary services provider in this case, and only actually got to meet with mom twice before, like, I had to shift some things around, and so I had to cease with her and pass her on to another provider. So that was kind of my role in this. And so the kids were still with mom. Again, it was due to drinking and driving. Mom no longer had the car. I believe that the father of the younger of the 2 children had taken the car back. Mom was really open to working with the provider, and was open to trying out the stuff that was suggested. And so, like I said, we're just what phase, just getting started, other agencies involved. As far as I could tell, the only thing that mom was involved with was DHHR and socially necessary services. And you guys know socially necessary services or in-home services or ASO services, we call them by different names. So far, the level of engagement was really strong. She had met 2 times. She was opening up a bit about her life. And so it's interesting that this happened to be the same day as the DV presentation, because that was one of the things that I was kind of hearing mom refer to, was kind of the relationship with the dad of the younger children, and some like power and control things, and kind of also starting to intimate to maybe some other previous trauma in her life that I feel like she would be willing to unload some of that if she felt comfortable telling someone. Oh, and so the 4-year-old was really challenging. And so even from the first to the second session, mom implemented stuff that was suggested to keep the 4-year-old occupied, because 4-year-old wouldn't even let mom talk, was just constantly threatened me with a rake. It was quite an experience. So the challenges are mom's drinking, and it's unsure exactly where she's at with that. I think it's theoretically possible that a person could get a first DUI and that person not actually have an alcohol problem. Chances are, if it's their second, that would be pretty indicative, perhaps, having the kids in the car, but that's kind of still a question mark. And so that was something that needed to be teased out a little bit. Also, the relationship with the dad. Mom does not seem to know what to do with that 4-year-old. And even though mom expressed a lot of care and concern about the infant, she really didn't pay that much attention to her. The 4-year-old, never been in structured preschool, very disturbing behavior, wouldn't let mom talk, interrupted, unable to be redirected by mom, the thing about the rake. And then the infant had been diagnosed with Williams syndrome. And Williams syndrome, if you're not familiar with it, is one of those chromosomal disorders that tends to have some physical features. It tends to have some behavioral characteristics, and then it tends to have some of those like lifelong health issues, kind of in the same way that Down syndrome does, or some of those other syndromes. And so Williams syndrome is one of those. And so the only thing that we knew of was mom was supposed to do in-home services, and that was all we knew. And so if there was more information floating around, we hadn't received it yet. And so then the question that I posed to the group was just, what types of services or resources would you recommend to the family? And so I came up with some, and then I thought that we could talk about other ones that I didn't think of. Do you want me to go through the ones I came up with?
Yeah, absolutely. That's completely fine.
Okay. So, you know, for mom, getting mom in some therapy, had some information on some community support groups for mom. We have Smart Recovery. The first AA.org is for AA in United States and Canada. The second AAWV.org is for AA in West Virginia, and then Celebrate Recovery, continue with socially necessary services, and then link mom with Family Resource Network to find out about additional community resources. For the any other things for mom that come to mind for folks? Feel free to put it in the chat or come off your mute.
I just think of too, like I think of moms in recovery and how they're automatic anytime, with Williams syndrome, there are some features that you can see and like you said, some behavioral pieces that are super stressful. And so a lot of the times, moms who are in recovery automatically go to that feeling of like, I caused this from my use. And so maybe even a support group for, medical specialties. In West Virginia, there are some support groups that have just medical specialties in general. Some have like Williams syndrome support groups. There are chat groups for Williams syndrome. That might be beneficial for her to learn that this is outside of that. And some of her struggles she's not alone with. And yeah.
Yeah, great, Amanda. I agree. Anybody else?
Due to the limited access to resources, a lot of my patients who experience, very specific types of things like, the rare genetic disorder, there are good Facebook groups for parents. Like you can find a Facebook group for really anything, but that's something else that came to mind.
Great. That's a great suggestion. Yeah. Folks love Facebook. Okay. Anything else? Okay. Moving on to the 4-year-old. Of course, wanted to get kiddo enrolled in school, get that part figured out because he definitely needs it. Kid also needs therapy. And I thought about parent-child interaction therapy for him. That's a really cool thing where the parent gets to learn some stuff and then the parent and kid work together, and then the parent wears like an earpiece, and so they get kind of coached on like how to do stuff with their kid when they're doing it. It like all happens like at the same time. So it's a really cool thing that that's out there for folks. Also thinking about like free community camps or play groups. In Monongalia County, they have a really cool thing called the Shack. And then in Philippi, there's a thing, everybody just calls it the Blue House. I think it might be their FRN, but I've always just called the Blue House. And they just do really cool stuff there for families and kids. And it's a really cool thing. So Disability Rights of West Virginia actually has a parents advocacy guide. It's online it's a resource for parents to kind of help them as they move into the school system to know what all the rules are and to help guide them to get the schools to follow the rules. It even has like template letters for parents who maybe don't feel super comfortable writing a letter. It kind of gets them started on that sort of thing. And so I put that on there. It's on the DRWV website. Anything else for 4-year-old? All right, we'll just move on to the infant here real quick. So of course I thought of birth to 3 for her. And then I just randomly looked up Williams syndrome support and came up with a support group. You guys have already come up with some other really good and possibly like closer to home things, because I think this was national. And so if mom could feel linked up closer to someone in West Virginia, that might really help her feel more support as opposed to someone randomly like out in California or something. And then thinking too that maybe the infant might be eligible for IDD waiver. And so IDD waiver is a program for individuals with intellectual and developmental disabilities. And it provides a lot of funding for different types of services and supports. And the first thing to do to get started is the DHHR has some really good stuff online for that. And so I put in that information too. She's really little. But there's a wait list. It takes a while. There's a process. You got to do a bunch of stuff. You got to follow up. And then there's a wait list because there's not enough money to serve everybody who needs it. And so maybe by the time she's like middle school aged, cross our fingers, she would have an active waiver slot and she can start getting some of those services. It'd be great if there was more money put towards that, so more people who need the services could get them. But that's where we are now. And so we just try to, work within the system that we've got while we simultaneously work to fix it. Anything else for our infant?
I think you have an amazing start. Like, I feel like you've really wrapped yourself around this family, and this mom, and like putting her in with birth to 3 and then getting that waiver simultaneously. That baby's going to need PT, OT, probably some speech outside of birth to 3. And a lot of the times that's not a smooth transition. So getting linked to that in advance is great support. I think some of the skills that she's going to learn in the parent-child interaction therapy with the 4-year-old, she'll be able to utilize with the infant. Like, I think you've done an amazing job, Deb, wrapping yourself around this family and helping support them.
Thanks. So it's 11 o'clock. So thank you.
Thank you so very much. That was excellent. Thank you for that case and all the feedback. The only announcement I have is the next time you'll meet will be on December 20th, and that'll be from the client's perspective, clients with lived experience panel. So we look forward to that, and have a great holiday with your friends and family, and we'll see you then. Thank you.
See
Bye,
everyone.
everyone. Happy Thanksgiving.